Hi, my name is Dr. Kimberly Cheong,
And I'm Dr. Sheena Kamra. We are both pediatricians in Torrance.
and today we're going to be talking about caring for your newborn baby. Just a quick reminder that you can ask questions on Twitter using the hashtag UCLAMDChat or by commenting on Facebook.
So this talk is for everyone, whether you're a seasoned parent, a first-time parent, or thinking about becoming a parent.
And first of all, we're going to start off by talking about feedings. You're going to be feeding your newborn either breast milk or formula. And we as pediatricians believe that breast milk is the ideal nutrition for your baby. But sometimes for various reasons, whether it's severe weight loss, rare metabolic conditions, or even just parental preference, your baby might be fed formula. And that's a completely safe alternative. In general, we recommend feeding every 2 to 3 hours on demand using your baby's feeding hunger cues. This could be anything from the baby opening his mouth and making sucking motions, or the baby might be chewing on their hands or even crying. And the goal is to get 8 to 12 high quality feeds in a 24-hour period. And an important reminder is that no additional water, tea, other liquids such as juices or foods are necessary at this age.
And in addition to the nutrition your baby will be receiving from breast milk or formula, we also recommend vitamin D supplementation in a subset of infants. So this would be if your baby is exclusively breastfeeding or receiving less than 32 ounces of formula per day. And the reason for this is because breast milk contains insufficient amounts of vitamin D, and we want to prevent vitamin D deficiency. If you're uncertain if your infant needs vitamin D supplementation or not based on what they're receiving for nutrition, please talk to your pediatrician about it. Another question we frequently receive are regarding spit ups. So spit ups definitely can be normal. So as long as they're a small amount, look like regurgitated breast milk, that can be a normal spit up. Things to look out for would be any large volume of spit up that's like vomiting, projectile vomiting, or if there's anything green, dark, or bloody in the spit up, then you would definitely want to talk to your pediatrician.
Your baby will spend a lot of time sleeping, and the safest position is on his or her back. We recommend back to sleep on a firm mattress with a fitted sheet. There shouldn't be any soft pillows, loose bedding, or stuffed animals in your baby's sleep area, especially around the baby's nose or mouth. To prevent or decrease the risk of SIDS, we recommend no smokers around the baby. And to keep your baby safe, we also recommend against co-sleeping if at all possible. Newborns usually sleep around 16 to 20 hours a day, and this can be anywhere from 1 to 4 hours of sleep, followed by 1 to 2 hours of wakefulness. A lot of parents say that their newborns seem to be nocturnal, and that's completely normal too.
So one of the reasons that we really emphasize putting your baby back to sleep and avoiding any tobacco or smoke exposure is because this can help reduce the risk of SIDS. SIDS is sudden infant death syndrome. And this chart right here just shows that the incidence of SIDS has actually decreased since the 1980s. In terms of wet diapers for your baby, so in general, you should expect 1 wet diaper on the first day of life, 2 wet diapers on the second day of life, 3 wet diapers on the third day of life, and from there onwards, a minimum of 4 wet diapers per day. And it may also be typical for there to be a wet diaper after most feeds. If the baby's dehydrated, sometimes you may see these pinkish red crystals in the diaper. They're known as urate crystals. If you notice that, just let your pediatrician know so that they can make sure your baby is growing well and receiving adequate nutrition.
Poops. We get a lot of questions about baby poops, and so here we'll spend a little bit of time talking about what's normal and what's abnormal. So in the first couple days of life, you'll notice that your newborn's stool is black and tarry. It can be hard to wipe off, and this is called meconium. It's completely normal. It's the stool that was in the baby's belly while he or she was still in the womb. And gradually over the next couple of days, you'll notice a transition to milk stools, which are greenish or yellow, brown, orange. Any type of pigment is good. And all babies strain while they stool. A lot of times this causes concern for parents because babies might scrunch up their face or turn red or look uncomfortable. But please be reassured that this is very normal in most newborns. And the normal stool frequency varies from several times a day to even once every 5 to 10 days. In general, as long as your infant is growing well, gaining weight, developing well, and has passed stool in the first 24 hours of life, we don't worry if there's a longer time period between stools. And actually, stool quality is much more important than frequency to determine whether or not an infant has constipation. So regular stools are described as yellow, seedy, mustard-like, a cottage cheese-like consistency. But if you notice that your infant stools are pebbly, small, dry, then please let your pediatrician know, because that is concerning for constipation. And finally, we recommend avoiding rectal stimulation or suppositories in infants. They need to learn how to stool on their own, and we don't want them to become dependent on these methods. So please avoid doing so unless directed to by your pediatrician.
So this slide here is just showing some infant stool colors. All of the colors on the left-hand side of the slide, so numbers 1, 2, and 3, are considered abnormal colors. As you can see, these range, and these have minimal pigment, so they're white, gray, very light in coloration. If you notice this in your baby's stool, definitely let your pediatrician know. The photos on the right, so numbers 4, 5, and 6, show a range of what may be considered normal stool color for an infant. So you'll notice that there's yellow, there's brown, and there's green, and all of these are considered normal. We also wanted to highlight a few things regarding infant safety. So something very important that you can do for your infant is have a rear-facing infant car seat. This has been shown to reduce the risk of death in infants under age 1 by up to 71%. But it's equally important that in addition to having the rear-facing infant car seat, you make sure it's actually installed correctly. A great website for this is seatcheck.org, which has a number of resources that can help you determine if your car seat's installed correctly. It can also direct you to local technicians that can actually check the car seat installation for you. In addition to keeping your infant safe in the car, we also want to keep them safe from infection. And so with newborns, we recommend avoiding very large crowds and anyone that might be a sick contact. I understand that sometimes this is unavoidable if you have family members in the home, siblings that are attending daycare, preschool, that may get sick. And so the best way to avoid spreading an infection to the newborn is really good hand washing in the home. And as Dr. Cheong mentioned earlier, we recommend avoiding tobacco exposure. This can help reduce the risk of SIDS. And then another important thing is you never want to shake the baby. So even if you're concerned about them or trying to awaken them, shaking them can cause significant amounts of harm. And so if you're trying to awaken or rouse your baby, you can try flicking their feet, gently rubbing their sides.
Some parents have questions about how to care for the umbilical cord after a baby's born. The stump usually falls off around age 1 to 3 weeks. And in general, we just want to leave it alone, keep it as dry as possible. There's no need for any special alcohol wipes or soaps. You can fold the top of the diaper down to keep it from being exposed to feces or urine. And in general, we recommend sponge bathing your infant until the cord falls off so that it can keep from being submerged in water and get wet. Please let your doctor know if there's any redness in or around the belly button. This can be a sign of a rare but serious infection of the belly button called umbilical. And this is a photo that shows an example. As you can see, the belly button looks red, it looks swollen. I'd imagine if we touched it, it's very tender. If you have any concern for umbilical in your baby, please see your doctor as soon as possible, as it generally requires admission and IV antibiotics.
We also wanted to talk about skincare for your baby. So no lotions or soaps are actually necessary. When you're sponge bathing your baby, you can just do it with water. And this photo right here is an example of something known as normal postpartum exfoliation. So you can see that the skin of this infant's feet, there's flaking, there's peeling, and this is considered normal. No treatment is necessary for this. We also had a few miscellaneous things that we wanted to cover. In terms of how to dress your baby, typically we recommend dressing the baby in the same number of layers as yourself. And you can use an infant hat, as they do tend to lose a lot of heat from their heads. You definitely want to avoid overheating the baby or keeping the environment much too warm. Parents also sometimes notice that their babies have tiny breast buds. This can also be normal. It's due to maternal hormones. If you notice this, point it out to your pediatrician and they'll continue to monitor it. Infant girls can also have vaginal bleeding or a clear white discharge in the first few weeks after birth, and this is also due to maternal hormones. Parents often ask whether sneezing and hiccuping are normal because babies can be doing this quite often. Both are considered normal. Babies also breathe primarily through their noses, and so anytime there's even a small amount of congestion, you might hear some noisy breathing. So it's a good idea to have a bulb syringe or a nasal suction device on hand to help clear out the baby's nose. You can also try over-the-counter nasal saline solution. If you do choose to use that, you can place a couple drops in the infant's nose and suction it out immediately.
We're going to be talking about postpartum depression next, which is a very real phenomenon that affects up to 1 in 9 women in the United States. And symptoms are pretty similar to those of unipolar depression. Moms might be crying more often than usual, feeling angry, withdrawing from their loved ones, feeling numb or disconnected with her baby, worrying that she'll hurt the baby, or feeling guilty about not being a good mom or doubting her abilities to care for the infant. And we thought it was also worth mentioning that up to 4% of fathers are also diagnosed with depression in the first year of their baby's life. The most important thing if you feel like you may be suffering from postpartum depression is to please ask for help, either from your partner, other family members, or trusted neighbors, your doctor. There are resources out there, and it's a treatable condition. It's usually a 2-pronged approach using counseling and medications, and it's the best thing you can do for yourself and for your infant is to ask for help. Please know that there's always hope.
We also wanted to talk briefly about some danger signs to look out for in your baby. So if you notice any of these danger signs, we encourage you to call your doctor or take your baby to the ER. So something that we are concerned about in babies is fever. So a fever is a temperature of 100.4 degrees Fahrenheit, and that's a rectal temperature. If your infant has this, it can be a sign of a more serious infection, and it's not something you should ignore. You should definitely call your doctor and take your infant into the ER. Increasing jaundice. So jaundice is when your baby's skin may look yellow. In the first few days after discharge, they may look a little bit yellow, and your pediatrician will be monitoring for this. But if you're ever noticing that the yellowness is increasing, definitely call your doctor as a very high bilirubin level. Bilirubin is what causes that yellow pigment. If the level gets very high, it can cause some serious complications. All babies will cry throughout the day for a variety of reasons, whether it's because they're hungry or if they need a diaper change. But if your baby is ever crying inconsolably, that can be a sign of something more serious, such as an infection or something else that is going on. And so you would definitely want to talk to your doctor and have your baby seen. If your baby is refusing to feed and has refused 2 consecutive feedings, we get concerned about possible dehydration and the reason for why they're not wanting to feed. So if they seem very lethargic, that can be a sign of something more serious, such as an infection. We talked about spit-ups before and what can be considered normal in a spit-up, but if there's ever anything green or bloody in vomit or a spit-up, you would definitely want to talk to your doctor.
Bleeding. Earlier we talked about a normal cause of bleeding, which was vaginal bleeding in newborn infants. But if you note bleeding from other sites, such as the belly button, the mouth, the nose, from the circumcision site, if your child is circumcised, or blood that seems to be coming from the urine or stools, that is considered an emergency, and you should seek care right away. Sometimes it's a sign of something called vitamin K deficiency bleeding, and this problem is something that we could try to prevent by giving all newborn babies as standard of care in the United States a vitamin K injection shortly after birth. Next, if you are worried that your infant is having any type of seizure, then please call your doctor, go to the emergency room. Seizures can be caused by multiple things, whether it's infection or an injury during birth, or they could even have an innocent or benign cause, but Sometimes they're also pretty subtle and short. It can be anything from facial grimacing to extremities actually moving or stiffening or jerking, or periods where the baby's not breathing. If you have any concerns that your baby is having a seizure or a convulsion, please seek care right away. And videos can sometimes help us. If you notice that your baby is looking blue, especially in the mouth or on the lips, this could be a sign that they have low oxygen levels in their blood, and so they should be evaluated to check for any heart or lung problems right away. And a lot of newborns have different types of rashes that parents are concerned about. And in general, your pediatrician will let you know if it's something that's normal or that's something that needs to be checked out. But if you notice that your child has an unusual rash, whether it's a deep dark purple color, it's spreading rapidly, there are large blisters, especially if the infant has a fever or is not feeding well, then please call your doctor or go to the emergency room right away. And finally, any sign of trouble breathing, whether it's a persistent cough or you feel like your infant is breathing heavily or quickly. A normal respiratory rate in a newborn is less than 60 breaths per minute. But if your child is exceeding that, especially for a prolonged period of time, then that's another reason to talk to your doctor right away.
Another thing we wanted to talk to you about was that we really want you to love and enjoy your baby. So talking, singing, and cuddling are great bonding activities that you can do with your infant, and you really cannot spoil your infant at this age. It's also never too early to start reading. All of that language exposure can really help them with their speech development. And we want to remind you to include everyone in the family in bonding with the baby, whether that's mothers, fathers, siblings, and grandparents. We want everyone to feel comfortable and happy bonding with the baby. If you have any questions, your pediatrician is always there to help. And you can ask questions on Twitter using hashtag UCLAMDChat or comment on Facebook. And it actually looks like we have some questions here right now. Okay. Do you want to take that question?
All right, so one of the common questions we get asked is, should my baby boy be circumcised? And circumcision is a very personal, sometimes religious or cultural decision for the family. And there have been some studies that show decreased risks of penile cancers or decreased risks of infection, but the official AAP stance is neither for or against circumcision, and they believe it's a personal decision for your family.
And then another question is, why does my baby need vitamin D? We spent some time talking about our recommendations for vitamin D supplementation. And the major reason for this is because over time, vitamin D deficiency in infants can lead to bone problems, including something called rickets. And so for healthy growth and nutrition for their bones, we definitely recommend the vitamin D.
With the Back to Sleep campaign, another common question we get is, how do I prevent my baby from getting a flat head on the back? And it is true that flat heads or plagiocephaly is much more common now that we've started the Back to Sleep campaign in the 1990s, but that is still the best position, the safest position for your child. In order to prevent a flat head, we recommend maybe around 3 to 4 weeks of age starting tummy time, where infants are placed on their tummy in a supervised period of time, and this will help the shape of their head become more round on the back. Other things you can do are kind of switching the position of the head. So if there is a crib that's against the wall, infants often like to look at their parents and look at what's going on in the middle of the room. So if you switch the head position back and forth, then they'll be able to have a rounder head in the back.
Perfect. And then how can I console my baby? So we did spend some time talking about infant crying and how that can be normal. And so, the primary way is if your infant's crying, it's trying to determine what may be the cause of the crying. And so if they have a wet diaper or a diaper with poop, you'd want to change it. If they are giving you cues that they want to feed, then feeding them can help. And if you've tried all of that and it doesn't seem to be working, then there are a few steps you can take to try to console your baby. Babies do often like to be swaddled, so you can try swaddling them. You can try having them suck on something such as a pacifier or be feeding. And then you can also swing them in your arms from side to side, and you can also make a shushing noise around them because that can also sometimes help soothe them.
All right, I think those are all the questions we had. Thank you so much for watching our presentation, and we hope you found it useful for you and your newborn baby.